Billionaire philanthropist Bill Gates and Nigerian business magnate Aliko Dangote have emphasized the importance of innovation and partnership in driving health progress in Africa. Good day, listeners. Welcome back to DDM Health News Update on our program. Your health, your wealth. I often remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, so you don't miss the latest on health. Okay. Billionaire philanthropist Bill Gates and Nigerian business magnate Aliko Dangote have emphasized the importance of innovation and partnership in driving health progress in Africa. You can imagine. According to them, investing in health is essential for economic growth and development. Sure, they also added that by prioritizing health and well-being, African countries could reduce poverty, increase productivity, and improve their overall quality of life. I believe so too. Speaking at the panel, discussion on funding and partnership held during the Goalkeepers Nigeria's event on Wednesday in Lagos. Gates expressed optimism that the rapid innovation and momentum from past public health successes can accelerate Africa's efforts to meet its health targets, save more lives, and drive long-term prosperity across the continent. How will you say that our country is progressing this way? He also said that the continent was poised for transformative progress, especially with new tools, partnerships, and investments emerging to tackle long-standing health challenges. Because we have lots of innovations, the ability to solve health problems would be that much better, and many of the diseases will be gone. Or not it? Also, Gates noted that the introduction of cost-effective vaccines, such as those for retrovirus and pneumococcus, had made significant inroads in improving child health outcomes, especially with the support of global alliance like Gavi, which funds vaccine for low-income countries. Yeah, we might be included in the low-income countries. Well, according to Gates, such innovations had already helped reduce maternal and child mortality, malaria deaths, malnutrition, and rates of mother to child transmission of HIV, while also increasing immunization coverage, which is very okay. Gates, who recently announced that the majority of his $200 billion pledge over the next 20 years will be invested in Africa, and Nigeria is one of the continents. Yes, Nigeria is an African country, focusing on primary health care, artificial intelligence in health systems, that is AI, and youth led innovation, emphasized that improvement in health systems would serve as a catalyst for economic development. Drawing parallels with parts of Asia, he pointed out that investment in health infrastructure had helped many countries transition into middle income economies that are not largely self reliant. He projected that African countries could follow a similar path in the next 2 decades. The billionaire philanthropist reaffirmed his foundation's commitment to spending the majority of its $200 billion projected endowment over the next 20 years in partnerships with African governments that prioritize the health and welfare of their people, showing that they have interests of the people in mind. Also speaking at the event, Dangote said Nigeria's recent achievements in the petroleum sector, transitioning from a net importer to housing the continent's largest refinery, should inspire a smaller transformation in the health sector. You can imagine Dangote getting his funding in the health sector, showing that honestly, these people really have their good thoughts of mind for us. Africa's richest man and chairman of the Dangote's groups stressed that with the right investment and leadership, the Nigeria could strengthen pharmaceutical manufacturing, improve healthcare delivery, and drastically reduce its dependency on foreign medical health, which is pure truth. Like, what matters is the leadership, the way forward. You can imagine. With all these things, I think the reduction of dependency on foreign medical care definitely will come to pass. Yeah. Dangote highlighted the partnership between the Dangote Foundation and the Gates Foundation in eradicating polio, enhancing nutrition, and bolstering primary health care in Nigeria as examples of what coordinated efforts can achieve. Wow. Hmm. On his part, the governor of Gombe State, Muhammadu Yahaya rather, revealed that sustained investment in infrastructure, funding, and access to modern healthcare tools had raised immunization coverage to about 50% in the state, with access of primary healthcare facilities raising to between 40 to 45%. Well, while sharing the progress his administration had made so far in improving access to healthcare, the Gombe governor noted that these improvements were already reflected in declining maternal and child mortality rates and better health worker performance. Yet, this is their aim: reduction of maternal and child mortality rate and a better health performance. I think with all this, the reduction definitely will be successful. The Goalkeepers Nigeria event, hosted by the Gates Foundation, brought together global leaders, public health experts, scientists, and change makers to review progress towards the United Nations Sustainable Development Goal. And among the high profile attendees were Lagos State Governor Babajide Sanwo-Olu, Minister of Health Professor Ali Pate, and the State Commissioner for Health, that is Professor Akin Abayomi, alongside other key stakeholders in Nigeria's health sector, showing that the events were truly a rich one. Finally, the National Information Technology Development Agency, popularly known as NITDA, has emphasized the need to design policies that internationally include approximately 35 million persons with special needs in digital literacy and technology empowerment programs. The Director General of NITDA, that is Malam Kashifu Inowa, said this on Thursday in Abuja when he received a delegation from the Inclusive Friends Association, a disability advocacy group. The delegation was led by the group's executive director, Ms. Grace Jerry. Well, Inowa said that including special needs person in their program would align with President Bola Tinubu's priority areas of reforming the nation's economy and inclusive growth. This has brought to many attention the need to be more international in the way we design our program, because there is no way we can achieve 95% digital inclusion if we exclude 35 million Nigerians. Inowa stated. Also speaking, the agency has always been conducting targeted training for people with special needs in various parts of the country in the past. He said, "We will ensure that we expand our initiative to all parts of the country, and our office facility has that in consideration. But our programs going forward will reflect this inclusion." The DG proposed the inclusion of representatives from the disability community in national ICT committees responsible for developing standards, training curricula, and policy framework. According to him, their presence would ensure proper representation and help drive implementation beyond bureaucratic limitations. He also suggested the integration of disability focused initiatives into national programs such as the National Youth Service Corps, Tech Initiative, Women's Training Cohorts, and major technology activities. These platforms, he said, provided value opportunities for networking, skills development, and enterprise support. For us, it's beyond just training. The real goal is empowerment. How we can train people to use IT to expand their businesses and improve their lives. Sure, I reaffirmed the agency's commitment to strategic collaboration and invited disability focused organizations to partner with NITDA in shaping an inclusive digital economy. So, as soon as possible, if this should come to success, definitely the digital economy definitely will increase. Also, she said that the government's goal of achieving 95% digital literacy by 2030 would only be realistic if it were truly inclusive, just like I said earlier. So, being inclusive shows that it will be realistic. So, with this, I come to the end of today's news on your health, your wealth. Be sure to like, share, comment, and subscribe to our YouTube channel, that is Diaspora Digital Media, to get this latest news in town. Until I come your way next, I remain Nenyo Michael Nezini. Thanks for watching. Do have a wonderful day ahead. Bye for now.